Could the next major healthcare opportunity come not from building more hospitals, but from helping patients stay healthier at home? That's creating a significant opportunity for companies using technology to rethink how care is delivered. One of those companies is Custom Health Holdings, which recently began trading on the Toronto Stock Exchange, bringing its technology-enabled medication management platform to public market investors. The company combines pharmacy services, remote clinical care, and its proprietary AdhereIT platform to support patients with chronic conditions and improve medication adherence. Joining me today is Shane Bishop, founder and chief executive officer of Custom Health Holdings. Shane, congratulations on going public, and welcome to the Capital Compass.
Thank you so much, Karina. Thanks for having me today. Much appreciated.
Now, for investors who are just getting to know the story, can you tell us about Custom Health, what the company does, and the problem you're trying to solve in healthcare?
Yeah, we've actually developed the platform, the full infrastructure that connects pharmacies that we own and operate to patients in their home that actually have a medication dispensing device and a connected care hub, our proprietary technology that actually sends data up into the platform where our clinicians work in real time to analyze this data coming from the device in the patient home. And we're actually connected right into physician EHRs and EMRs. So we actually have a full platform connecting data from pharmacy to patient to clinician on our team, and then down into the physician offices where we actually make recommendations in real time and allow physicians to do a better job with the data that we actually collect. So it's a kind of we call it an infrastructure, positioning and play.
And very time efficient. And as healthcare increasingly shifts toward home-based care and remote monitoring, investors are paying close attention to companies that can improve outcomes while lowering costs. What is driving the growth of the business today? Is it increasing demand for medication management, the expansion of your pharmacy network, your technology platform, or a combination of these factors?
I think it's the combination of the factors. When we actually pulled together the pharmacies that we owned and operated and connected to the patients with the device and brought in the clinical team to actually do something with the data, that's where we started signing all the large contracts. So, the groups that are, pushing this technology to patients that they look after are actual pain providers, large provider groups in the U.S., where there's reimbursement mechanisms set up by the U.S. to cover our solution, which is kind of the right place, right time for us. And also we have a number of state Medicaid deals and plans that actually pay for the technology where they have actually shown an ROI by actually implementing our technology, our clinical oversight, instead of actually having their staff or, case managers, care workers coming into the patient home 4 times a day to deliver medication. We actually take care of that remotely, and we've saved, a lot of dollars, and we have some published data on that. So really twofold: health plans, state Medicaid plans, that kind of grouping, as well as providers who want their patients on this technology.
The public markets also tend to reward healthcare companies that have multiple growth levers and clear opportunities to scale. Now, looking ahead, what are some of the key catalysts and milestones that investors should be watching for from Custom Health over the next 12 to 18 months?
Yeah, I mean, absolutely. I think we have the right secret sauce to access the public markets right now, which is kind of why we went in this direction. You can think of us as somewhat of a sophisticated pharmacy roll-up strategy. We're making acquisitions of pharmacies in key geographies where we have payers for our in-home technology and clinical service. So we'll go in and make an acquisition like we just did in a recent announcement. We bought 2 pharmacies under the banner Innovative RX. They are pharmacies in geographies where we have these payers lined up. So we have to make that acquisition of the pharmacies, actually grow the pharmacies quickly by pushing patients into those pharmacies that are coming from our payers. And on top of that pharmacy revenue and pharmacy growth, we have the extra SaaS tech clinical revenue on top of that. So it's a very exciting model. And so as we grow and move forward, you're going to see, announcements in, pharmacy acquisition space, always in geographies where we have payers lined up. So again, driving both the inorganic and organic growth at the same time. Pretty cool model. And pharmacies are excited to join. We do, half kind of cash, half stock transaction. That's why we wanted to access the public markets and jump on the TSX. Lots of opportunity to consolidate the market in that space and leverage our technology to grow, with these patients.
And is there anything else you want investors to know?
I think, it's an exciting space and time right now. We are focused on the U.S. I would suggest 80% of our time and effort is in the U.S. The payers have lined up in the U.S. The government's putting a lot of money into remote patient monitoring, remote therapeutic monitoring, kind of our niche. And, medication management is a key component of that. Lots of activity in Canada. We have a lot of great relationships. We've done a lot of studies. We've been published in a number of geriatrics journals, and we have the data to support our solution. Payers in Canada are a little slower to adopt, but that said, I think a nice 20/80 mix is what you're going to see from us, and continued steady growth, through acquisitions and our kind of organic growth strategy.
All right, so this appears to be a story of healthcare innovation, recurring revenue, and a large addressable market, with custom health aiming to become an important piece of the infrastructure that helps patients manage medications and receive care at home. The company recently listed on the TSX and is pursuing growth through both organic and acquisition across North America. Custom Health trades on the TSX under the symbol CHLT. Thank you so much for your time today, Shane.
Thank you, Karina. Much appreciated. Take care.
And thanks for watching the Capital Compass. I'm Karina Robertson.